It's time for you to have your sinusitis C&P exam. The purpose of this exam is to confirm you have sinusitis. It is to determine if it is service-connected. Many veterans are curious about the actual exam process. All right, let me tell you. Your medical history is examined first. Your service treatment records, any post-service medical care, x-rays, CT scans, and notes from sinus surgery will all be reviewed by the examiner. You will be asked about the onset of your symptoms, the frequency of your sinus infections, and if you received treatment during your time in the military. The examiner will follow with a few questions such as, how often do you have sinus infections? Do you have chronic, meaning lasting more than 3 months, or recurring, which is multiple times a year? Sinusitis, do you take antibiotics? How many times per year? Do you experience headaches, nasal discharge, facial pain, or pressure? Have you had sinus surgery? If yes, when and what type? After the DBQs, or Disability Benefit Questionnaire, is over, the next step is the physical examination. The examiner might ask to take a look inside your nose and sinuses using a light or maybe even a scope. They could press on your face and forehead to see if that causes any pain, and they'll probably check how well you can breathe through each nostril. Sometimes they'll also look for things like nasal polyps or other obstructions, and if you haven't had any recent imaging, they might order x-rays or CT scans just to get a better idea of what's going on. Now, here are some really important things you'll want to document or mention to the examiner. First off, how many sinus infections you've had in the past 12 months that actually required antibiotics. Also, if you've had any surgeries, it's important to talk about those and whether or not they help. And don't forget to mention any symptoms you have between infections, like congestion, losing your sense of smell, or having trouble breathing, just to name a few. You should also let the examiner know about any headaches or facial pain you get that are related to your sinusitis. Plus, be sure to tell them how many times you've missed work or your regular activities because of sinusitis. The examiner really needs to hear things like, "It got so bad I started missing work. I couldn't even go to David's retirement party. We worked together for years." These details help paint the full picture of how sinusitis affects your life. You know, I have to remember to carry gum around with me because my grandchild told me my breath smells, and well, it wasn't due to the coffee. These things can be embarrassing. VA ratings for sinusitis. The common ratings are as follows. 0% is granted if the examiner sees it's only detected by X-ray and there are no incapacitating episodes. 10% is granted for 1 to 2 incapacitating episodes per year needing 4 to 6 weeks of antibiotics, or it could be 3 to 6 non-incapacitating episodes yearly with headaches, pain, and discharge. So 30% is granted if you have 3 or more incapacitating episodes per year that need prolonged antibiotics, or, more than 6 non-incapacitating episodes in a single year. And 50% is granted following radical surgery with chronic osteomyelitis, or when there's near constant sinusitis with headaches, pain, and, purulent discharge or crusting. An incapacitating episode means, well, if you're requiring bed rest and treatment by a doctor, that's what we're talking about. Here are some tips for you. Be prepared, bring a list of recent antibiotic prescriptions, any surgeries you've had, and make a note of how often sinus infections interfere with your life. Remember, this is your life and you live it. You are the only one who really knows how you feel. This is your chance to explain it to the examiner. Good luck. You served, so you deserve.